Next, now that we've generated solutions, we want to take action, or what will I do? And they might ask, should you do something, or how do you do something? And here we've got new laboratory results, and we're asked, which of these orders do we prioritize? So we're looking for something that's going to address the problem most directly and most quickly. So let's take a look at our new lab results, where we have got a sodium that's a little bit low, a potassium that's in the normal range, and then that BNP is elevated. So it is looking like we've got stretch on the heart from too much fluid. So what do we want to prioritize? Preparing for a chest x-ray, giving enalapril, giving furosemide, or preparing them for an echo? I want to point something out. You guys might have heard this kind of test strategy that on the NCLEX, when you prioritize, you always pick to assess first. Have you guys heard that? And that is only true sometimes. Sometimes we already have all the information that we need to act. And so we've got two actions here, assessing, right, by getting a chest x-ray, or assessing by getting an echo. But I don't really need, if I'm prioritizing ABCs like we should, I don't need to look at his chest x-ray or his echo to know that he's got too much fluid. And so several of you guys have mostly guessed, yep, Susan says action to remove fluids, right. And that is correct, but let's talk about this enalapril. What drug class is that? Enalapril is an ACE inhibitor, right? And that would lower the blood pressure. So although that is indicated and that would reduce the strain on his heart, the reason that we'd give furosemide first, and you guys guessed it, that this is going to be removing the fluids. Now, furosemide, we might give that and his blood pressure would drop already, right? So if we give the furosemide, we pull off enough fluid, give him some relief, and his blood pressure drops, we might not even need to give the enalapril. So just a little tip for you there. We want to pick the action that's going to most directly and quickly fix the problem. And Vanessa has said that a chest x-ray and echocardiogram won't change the fact that they still have heart failure. And you are absolutely correct. Sometimes we don't need to assess first, and the results of that or that won't change whether or not he needs Lasix now. If we did not yet have his potassium level, maybe I would need to draw the potassium level first, right? Because that would tell me whether or not it's safe to give the furosemide. But that wasn't the option here, so we already know that it's a safe level and we can give it. So well done. So when we're prioritizing, we're going to be looking at our prioritization pyramid where we eliminate stable and chronic issues and then prioritize our ABCs. And that's what we did in that prior question, is we prioritized the action that was going to relieve his breathing problem by pulling the fluid off. Now we are at our final step. So evaluating our outcomes, we might need to answer, was our intervention effective, including teaching? Was our teaching effective? Or maybe what signs would indicate a complication or improvement? So you're following up and evaluating how what your intervention was affected the patient. So here, it's now 2 days later, this patient's improved, they got their furosemide and enalapril, they're going home for discharge. And they're being discharged on those meds, the enalapril, metoprolol, and furosemide. We've given the discharge instructions, and which statement of theirs indicates that the teaching was effective? Select all that apply. And here's another tip for the NCLEX. When you're answering select all that apply questions, treat each option as if it's its own true or false. So I want you guys to answer true or false as we work through these together. So true or false, it's best if I take my furosemide first thing in the morning when I wake up. And that's true because furosemide, we've already established, is a diuretic, and that is going to make you pee a lot. And a little trick here, furosemide, the trade name is Lasix, and the mnemonic is that it lasts 6 hours. And so if you take your diuretic at 9 p.m., your patient is not going to get to sleep until like after 2 in the morning, and they're going to be really unhappy with you. And they're not going to get better because sleep is really important. So yes, we want to take diuretics in the morning, and that is on our diuretics cheat sheet that Dr. Courtney kindly worked on. And so you guys can come check that out if you're members of the Bootcamp website. Then next, I should avoid eating prepackaged foods and over-seasoning my food with salt. And yes, you guys are all selecting number 2, and that is correct. A lot of patients, when they're told to limit their sodium intake, because sodium follows water and we don't want fluid retention, they think, oh, I'll just take the salt shaker off the table. But Most of the sodium that we eat in our diet comes from packaged foods. So that is an important thing to make sure they know, is to read the labels on packaged foods to look for something with too much sodium. Then how about 3? Should they contact their healthcare provider if they gain more than 3 to 5 pounds in a week? True or false? And yeah, that is true. We definitely want to notify the provider. The reason that we're weighing regularly is because we're watching for fluid retention. If somebody has 5-pound weight gain in a week, that's not fat, that's fluid. And this person is at risk for a heart failure exacerbation. Now, to detect that, should we weigh weekly or how often? Is this true or false that they should weigh weekly to make sure they're not retaining too much fluid? And I really hope you guys remember that we should not be weighing weekly, we should be weighing daily. Every day with the same time, same scale, same clothes. So this is not correct. We would need to correct them and say, no, you need to weigh yourself every day. The week comes in when you've got 3 to 5 pounds weight gain in a week. Then next, certain over-the-counter medications like antacids can contain high amounts of sodium. And remember, guys, medication interactions is big on the NCLEX, and a lot of antacids contain sodium, calcium, like calcium carbonate is Tums, and so that can be a hidden source of sodium. We never want to ignore over-the-counter medications because they can be just as dangerous as some of the prescription ones. So this is correct as well. That is it, and I'm going to answer Omar's here. He says, just to clarify, we would still administer diuretics even if the sodium levels are abnormal or low. Will it not worsen the electrolyte imbalance? Omar, that's a really good question. And the answer, as with anything, is it depends. But I'm going to phone the audience here. You guys, why would somebody with heart failure have a low sodium level? Somebody with heart failure would have a low sodium level because it's dilutional, right? They're retaining too much fluid, and so that dilutes the sodium in the blood. And so in this case, we need to pull fluid off. And remember, furosemide is a potassium wasting diuretic, meaning that it spills potassium into the urine, and potassium acts like a salt as well, just like sodium does. And so in this case, it would lower their potassium much more dramatically than it would their sodium. So we're going to pull off potassium and water is going to follow it, and that's going to raise the sodium level. So very good question, although I believe thiazide diuretics, those work more on sodium excretion. So in that case, you would not give it. But I don't think that's actually something really important on the NCLEX related to thiazide diuretics, so you'll just have to go check out our diuretics cheat sheet for the answer.